a new series that is oncology modules. So there are three oncology modules. I will be discussing one each week. Oncology as such is covered in the individual systems like GI, Euro. So this will be more of general oncology, basic principles, and a few specific cancers about which you need to know a little extra. Okay, so as such, oncology is a very vast and a very difficult concept to understand. At least the basic principles I will cover, but nonetheless, you should go through all the videos in the app when you are studying the individual systems like GI, Euro, general surgical cancers, because each of them will have their own staging, investigation, and treatment. So here we are going to solve or focus more on the broader oncosurgical principles. Okay, so you will get more of facts in these modules, some clinical questions also, right? So let's start with today's module. That is the first module of oncology. Some of you may be attempting to become oncosurgeons in the future, so this one's more important for you, right? So let's start with the first question here. A patient presented with lung cancer and he came to the casualty with life-threatening massive hemoptysis. All of the following surgeries can be done in the management of this patient, except basically this is an emergency massive hemoptysis. Okay, emergency massive hemoptysis. They have not told you the patient's clinical condition. Is he vitally stable or not? He should be stable because usually the hemoptysis stops by itself. But nonetheless, which of these is the least likely to be used? Now, whenever you are given a question like this, you have to use your common sense. If there is a cancer which is causing massive hemoptysis, means it has invaded a major blood vessel, means something major has to be done. Now, of course, you can cauterize it bronchoscopically. So if you find the bleeder bronchoscopically, if possible, you can embolize them, or you can do balloon tamponade. But doing a lobectomy usually will not suffice in massive hemoptysis. So best answer here is lobectomy of affected segment. It will not also, it won't even cure the cancer because it may not be an oncosurgical resection. So amongst these, this will be the least likely. Okay, this will be the least likely. The others can be done as an emergency measure. Once the patient is stabilized, then you plan the oncosurgery depending on the stage of the tumor. Right? So these kind of questions are going to be asked. You have to solve them using basic principles, basic understanding, and not a very high-fi over-analysis. Don't over-analyze these kind of questions. Okay, this is a yes and no question. Either you know it or you don't. Most common variety of benign salivary tumor. Okay, of benign salivary tumor, mucoepidermoid mixed more than oncocytoma adenoid cystic. Now, mucoepidermoid is malignant. Okay, adenoid cystic is malignant. Oncocytoma can be either, but usually it is malignant. What is this mixed cell tumor? And this is Warthin's tumor. What is this mixed cell tumor? Any idea? Mixed cell tumor. This mixed cell tumor is commonly known as, yes, that's right, it is commonly known as pleomorphic adenoma. Okay, it is commonly known as pleomorphic adenoma. And that is the most common benign salivary tumor. Okay, this is the most common benign salivary tumor, mixed salivary gland tumor. Why is it called pleomorphic or mixed? It's because it's a tumor which contains glandular elements, the epithelial elements. So parotid, submandibular glands, they are glands. So the tumor consists of glandular elements, but it also consists of stromal elements. Okay, stromal elements like myoepithelium, collagen, spindle cells, myoepithelial cells, collagen. These kind of stromal elements are also a part of the tumor. Hence, it is pleomorphic or mixed. Now, if they ask you most common salivary tumors, easy way to understand is you put it like this: benign, malignant, and there are three pairs of salivary glands which contain the tumors. One is the parotid, other is submandibular, and the last are sublingual. These are my three major salivary glands. The most common benign parotid tumor is pleomorphic adenoma. The most common benign submandibular tumor is also pleomorphic adenoma. And the most common benign sublingual salivary tumor is also pleomorphic adenoma. Alright, which is why overall the most common benign salivary tumor is going to be pleomorphic adenoma. But the malignancies are a little different. The most common malignant parotid tumor is mucoepidermoid cancer. The most common malignant submandibular gland tumor is adenoid cystic carcinoma. And sublingual is adenocarcinoma. Okay, it is adenocarcinoma. Most of the parotid tumors are benign. So most of the parotid tumors, 80%, 80 to 90% are going to be pleomorphic. In submandibular, benign malignant are half-half. So pleomorphic can be 50%, adenoid cystic can be 50% amongst the whole group of tumors. And in sublingual, most are malignant. So pleomorphic will be little less. Adenocarcinomas are more. Okay, this is a very useful table. If you read general surgical books, you will get approximately these values. Okay, you will get approximately these values, but yes, definitely the most common overall, whether it is submandibular, sublingual, or parotid, is always going to be pleomorphic. Let us not assume pleomorphic is exclusive to parotid. It is not. It is seen in all the salivary glands. Okay, and pleomorphic adenoma is also commonly called as mixed salivary tumor. Okay, mixed salivary tumor, right? So that is the next answer. Now, the most common site, this is a little incomplete, the most common site of salivary gland tumor overall. Overall, where do you get salivary gland tumors? Answer is going to be parotid. Okay, parotid overall is the most common site of salivary tumors. And of course, that is pleomorphic adenoma, which means the other glands, that is sublingual and submandibular, they don't get tumors that commonly. And if they get, usually they are malignant. Okay, that is the message that you should get from this question. They can twist these questions in various ways. Simple to remember, overall most common salivary tumor, pleomorphic adenoma. Overall most common site of salivary tumor, parotid gland, pleomorphic adenoma. Okay, overall if they ask you most common malignant, that will be unique to each gland. Okay, that will be unique to each gland. That is not overall salivary tumor as a whole. What is unique to adenoid cystic carcinoma? It shows a unique property since we are discussing it. What is the unique property of adenoid cystic tumor? Yeah, this can also come in MCQ. It shows early perineural invasion. Okay, it shows early perineural invasion. Fine, right? Okay, let's move.